Hello! Today we're continuing our series on heat-related illness. We're going to break down the 5 different types, subcategories, and describe those so you'll be able to better identify what's going on. The first is heat cramps, which don't always have to be heat-related. They can happen with cooler considered sports like swimming or ice hockey. So sometimes people will call them exercise-related muscle cramps. The hallmark of these is that they are very intense muscle pain not associated with an injury, and they can actually last quite a while. They often happen when someone is participating in a newer activity, something that their body is not very used to. Next comes heat collapse or syncope. Syncope is our fancy word for passing out. One of the things that sets this apart is that the core body temperature is not elevated. With this, people will get what we would consider overheated after they've been standing for a long time or standing after they've been sitting for a long time in the heat. People with heat collapse tend to get lightheaded and may even pass out. Often they're unable to walk. They'll get really pale and sweaty. But when they sit down and rest, they tend to recover pretty rapidly. The next stage in the progression is heat exhaustion. One thing to note is that dehydration is not required to have a diagnosis of heat exhaustion. We do start to see the core body temperature go up, usually between 101 to 104 degrees. So this is when we really start to see other things start happening in the body. With this, we will start seeing weakness, coordination problems. We can see belly cramps, headache, nausea, vomiting, and diarrhea, and great difficulty with walking or continuing with your activity. With these changes, we may start to see your heart rate go up and your blood pressure go down. Next up is heat injury. This was a subcategory added by the U.S. military. Thank you for your service. So with this, we do see temperature elevations, we do see dehydration, but we do not see the mental status changes that we'll see with heat stroke that we'll discuss in just a minute. With this, the big change from heat exhaustion is that we can start seeing damage to the liver, the kidneys, and the muscles, and it gets a lot more serious when we get to this level. Next up is heat stroke, which is very serious and can be deadly if not treated. With heat stroke, your core temperature is greater than 104 degrees. We have a significant amount of dehydration going on, and we also see damage to kidneys, liver, and skeletal muscle, which is called rhabdomyolysis. That's where the skeletal muscle starts to break down and cause a significant degree of muscle pain, obviously. The mental status changes associated with heat stroke can be as simple as headache, but also can include confusion, irritability, seizures, and coma. Stay tuned, because in my next video, we're going to discuss the treatment and prevention of heat-related illness.